led by its chairman and secretary to the government of a federation, Boss Mustafa, approved the implementation of new protocols for the second phase of ease of lockdown of the national response to COVID-19 spanning 2nd to 29th of June 2020. Consequently, places of worship have been reopened. That's heartwarming, right? Now we have in the studio to speak more on measures taken to ensure that churches comply with laid down protocols. The chairman, Christian Association of Nigeria, CAN, North Central Zone, Reverend Israel Akanji. Glad to have you join us, Reverend.
Thank you very much.
Reverend, I can see you're looking so different with your car this time around. Now, after 2 months, more than 2 months, churches will be open for Sunday Mass and services. What feeling do you get for that?
Well, thank you very much. You can see that we are all very excited. For the past 10 Sundays, that's 2.5 months, all the churches have been on total lockdown. And we've been looking forward to the easing of lockdown concerning places of worship. We were really glad on the 2nd of the month of June when the announcement came that there is an easing of lockdown on places of worship, and protocols have been given on how the worship should take place. So we give all
Seems to be having audio challenge. We'll quickly take a break. We'll fix it and we'll come back. We'll see have Reverend Israel Akanji in the studio.
Operation wear your mask, especially for people who don't old. No forget, your body no tranga like before. You not even tranga like your children or your grandchildren. So therefore, always wear your mask for this pandemic period. No they to receive visitors, so even if na your grandchildren. Make extra mask where you go fit wash, make like 2 and dash your neighbor 1. And if you dey come out for house, wear your mask always. And if you come back, wash your hand with soap and running water to avoid coronavirus. Make you for live long for your children and your grandchildren. No forget, Operation wear your mask, especially for people who don't old. Protect me, I protect you. Na coalition of societies for the right of older persons in Nigeria, COSROPIN, join body with National Orientation Agency, NOA, bring on this message.
Thanks a lot for staying tuned into the news. Let's quickly go to Kogi State, where the government has relaxed the lockdown on Kaba Bunu local government area, having achieved a successful contact tracing and sample collections for COVID-19, with all results turning out negative. Correspondent Francis Udojo has the reports.
The lift of ban by Governor Yahaya Bello came shortly after a closed-door meeting with top government officials and security operatives. The ban, which commenced Monday, was expected to last for 2 weeks, but has now been lifted following the results of the state medical team, who earlier went to Kaba Bunu to carry out the medical exercise.
The team led by the Honorable Commissioner for Health, Dr. Saka Audu, went swiftly into the local government, beginning with the family members of the purported COVID-19 cases. Tests were conducted, and those tests came out negative.
The samples and test results, government says, will be sent to the NCDC laboratory to further clear doubts on the issue. The Kogi State government admonished the NCDC to be astute and strictly follow laid-down procedure and guidelines as against its initial process with the index case. On another issue relating to security matters, the security operatives were charged to bring perpetrators of the robbery attack on a bank and divisional police station in Isolu to book. Governor Bello urged family members of the deceased to take heart, as he promised to do everything possible to protect the people of the state. From the government house, Lokoja, Francis Udojo, NTA News.
All right, we'll see how Reverend Israel Akanji, Chairman, FCT Chairman, Christian Association of Nigeria, North Central Zone, in the studio, and we're good to go now. Reverend Sir, I was talking about coming back after 2 months of a break. Churches and will be open for mass and services tomorrow, Sunday. What feeling do you get for that?
Thank you very much. For 2.5 months, 10 Sundays it was last week, we had total lockdown of places of worship. And today we really thank the Almighty God for his intervention to bring us to the easing of lockdown concerning places of worship. We want to thank the federal government and the Presidential Task Force for the great job it has been doing. So we have been giving guidelines concerning how the places of worship will begin to operate. And we are told that we are going in phases. So it is not opening of the church to the exact thing that it was before, but a gradual opening of the church and places of worship for worshipers to be able to attend. Therefore, the time for worship has been limited to 1 hour, and all the precautions and guidelines concerning COVID-19 pandemic have been given to the church. Things that have to do with washing of hands, using of hand sanitizers, using of the face mask in church, and social distancing. We are supposed to be in the church and maintain 2 meters apart, one person to another. We are also to do temperature measurement of people, and people whose temperature is considered high are not expected to come into the place of worship. Because of the peculiarity of the place of worship, there are also several guidelines in the interior of the worship. When the worship is taking place, things like the appliances, implements of worship, the guitar, the organ, the microphone, saxophone, trumpet, all what have you that we use in worship, they are not supposed to be shared. And when we meet for 1 hour, we are supposed to leave the place of worship is supposed to be disinfected, and then people come back again to worship. So we have guidelines, and we believe that we are prepared to be able to follow the guidelines. To
ensure, again, that leaders of churches comply to all of this, I'm sure you want to say. Now, taking into cognizance past experiences during the total lockdown, do you think it would be easy to observe social distancing during services?
Yeah, definitely it will be easy because of the measures that are already being put in place. In various churches now, the sitting arrangements have changed. People have gone to churches. After disinfecting the churches, they have mapped out how people will sit, and therefore we will ensure that the distancing is in place. And then the number of worshippers has been reduced. We have been told to ensure that about just 1/3 of normal worshippers come into the church worship at a time. And we have been allowed to do multiple services, so you can have 1 hour service and then disinfect, come for another 1 hour and then disinfect. So all these things are going to be followed. Definitely we can, because in the churches we have medical teams, we have security teams, we have protocol teams, we have ushers, we have deacons and elders, people that are able to ensure that we follow all the regulations. Therefore, we have the assurance that
Reverend
it will be done.
It seems you have done a lot to ensure that they comply with all the laid down protocols. Now, are there measures that your association is putting in place to monitor compliance by churches? It's not alone, good enough to give out protocols or measures or instructions. How are you monitoring that?
Thank you very much. The Christian Association of Nigeria has set up various groups to work, to operate at various levels to ensure the monitoring. And we're working hand in hand with the government agencies that are in charge of monitoring. Therefore, yes, we have put structures in place. because sometimes when you have regulations like this, some people may not take it very seriously, but we want to take it very seriously. Just like we complied when the churches were totally locked down, we want to comply now that the churches are being opened for worship. And we have put in place measures to be able to track people who may not do it right, and a lot of measures to take also as disciplinary measures for people who do things wrongly. So we are quite sure that these measures we have put in place with the government agencies that are also there to ensure compliance, we will definitely be able to have compliance, and things will go well. And we are looking forward to opportunities to just come, praise God, worship together. We believe that now that the churches are unlocked and we can worship, we believe that we are gradually coming to the end of the pandemic, because we trust that when we pray to God, God is going to help us. So nobody will want to lose that opportunity of coming to pray.
Reverend, that's the hope of all Nigerians. That's coronavirus will pass soon. Reverend Israel Akanji, thanks a lot for your time. Reverend Israel Akanji is the chairman, Christian Association of Nigeria, North Central Zone. Now, moving on. The federal government has approved the donation of 150 trucks of assorted grains as palliative to cushion the effect of COVID-19 in Jigawa State. Minister of Humanitarian Affairs, Disaster Management and Social Development, Hajia Sadia Umar Farouk, stated this when she met with Governor Muhammad Badaru Abubakar ahead of her official engagement in Jigawa State. Muhammad Musa Askira has the reports.
Coronavirus pandemic and its attendant consequence of lockdown of communities, restricting people from going out to seek for their daily bread, among other activities, has left a huge negative impact on residents of the affected areas. As the Minister Hajia Sadia Umar Farouk explains, the approved donation of the assorted food items, which include rice, millet, maize and guinea corn, will soon arrive the state to cushion the suffering of residents in the state caused by the global COVID-19 pandemic.
We are bringing about 150 trucks into the state of these grains for onward distribution to the poor and vulnerable across the state as part of Mr. President's response to the COVID-19 pandemic in Jigawa State.
My father, your father, our father, Babu Buhari, have done wonderfully well, and thank him on our behalf. Thank him so greatly. He has supported us so much. His agricultural revolution has yielded a lot of returns. Farmers are enjoying, and they are marrying more wives.
The minister was in Jigawa State to flag off distribution of fertilizer and farm inputs to victims of flood disaster in the last year's farming season. From Dutse, Muhammad Musa Askira, NTN News.
In security matters, 70 bandits have been eliminated in Kaduna State by troops of Operation Thunderstrike under Operation Accord in conjunction with vigilantes. A statement by the Coordinator of Defense Media Operations, Major General John Enenche, indicates that the successful operation conducted by the Land and Air Forces is equal to timely and credible information. Similarly, troops of Operation Yaki in blocking position for Operation Accord are the outskirts of Konkomi village apprehended 2 bandits logistics suppliers. General Enenche enjoined the people in general area to urgently report persons with suspicious injuries to security agencies to ensure rapid mopping of criminals attempting to escape. And on foreign scene, French forces in Mali say hot troops have killed the leader of Al-Qaeda in the Islamic Maghreb, Algerian Abdel Malik. French Defense Minister Florence Parly says the leader was killed in the northwest Mali town of Tessalit, and many of his close associates were also neutralized. France also claimed on Friday to have captured a leader of Islamic State in the Greater Sahara Group, which carries out frequent attacks over Niger's western borders. France has over 5,000 troops deployed in its anti-jihadist force in Sahel region. And that's it on News on NTA International. Thanks a lot for your time.
Value. Workers have value. And if they have value, what is the difficulty in discussing? Put the facts on the table. This is what I have. This is the difficulty I have. How can we navigate? Because it's a temporary challenge. Hopefully we'll get out of it. And we must also recognize the strategic contribution that workers have done over the years in different establishments, both in the public and private sector, to build our economy and build those institutions to where they are today. How can we so soon forget the contribution, very strategic contribution of those workers? So what we are saying in essence is that we are not trying to invent a new wheel. No, we are trying to say that, can we respect our laws? Can we respect international best practice? ILO Convention is very clear on that. Convention 87 and 98. That in such a situation, we must have a conversation where everybody will be on the table. Government as a sovereign, not as an employer in this case. Government will be on the table as a sovereign, because the primary purpose of governance is the security and welfare of the people. So government will be on the table by ILO standard as a sovereign to actually try to be the judge to balance some of those issues. The workers' representative will be there. Then employers' organization will be there. That's the tripod to look at the challenge sector by sector, both public and private. And also, we must put in place some packages, either in form of palliative or in form of stimulus, that will also mitigate some of those issues. All of those issues will be discussed on the table, because they should be live after Corona-19. So this is what we are talking, and this is what we have been preaching, and this is the line of thinking of the global world now. And I think even at that level, we have gone further, because even at the level of the UN, those issues have been well stretched. And ILO have been part of the process, and countries have been encouraged to follow this 4 pillars approach to try to respond to some of those challenges. So we are not rigid in our approach. What we are merely saying is that don't go and just cut our salary and hiding under COVID-19, whereas you are making profit. Now in some of those organizations, they have posted humongous profit, like the banking sector. Humongous profit.
Now these are the issues that are beginning to emerge. Let's for a start, let's take the public sector workers. Nigeria, as we all well know, derives a large chunk of its revenue from the sale of crude oil. That has just about gone now. Reports from all over the world say producers are paying buyers to take the oil off them. So all that is down. Nigeria only recently agreed on a national minimum wage. And even that was problematic. You had the federating states. Many of the states complained about that. In fact, it would seem that not all the states have started paying the new national minimum wage. And now you have a situation where many of the states, or virtually all the states, come to Abuja every month to share revenue. That revenue has dwindled now as a result of COVID-19. Now these are governments that had always threatened to lay off workers. Now they have a fine, excuse to do that. What level of dialogue have you been in with particularly the states?
Thank you very much. Let me say that in every situation, whether pleasant or unpleasant, we have choices to make. And in this case, as a country, as a government, as a people, we have choices to make. There are choices we can make that can actually be a first saving measure to try to address the issue in the interim. And I think in this type of situation, this is what is required, to look at the issue and then see how best we can get out of it. Even when resources were available and we never had challenge of COVID-19, some of our employers, including some of the state government, to part with the money becomes very difficult, because some of them prioritize white elephant projects that possibly don't have direct bearing with the life of their citizens than to pay worker salary. And I can tell you that from empirical data. States that are receiving very low in terms of revenue are the first to implement the minimum wage. Take, for instance, state like Borno, where you have the insurgency, where what they have is very small. But yet, without any strike, without any argument, it was implemented. States like Jigawa, that never assessed the bailout, yet they were able to pay, including paying pensioners. So it's about choices. It's about how we look at the worker. It's about how we're able to put in place good governance. Those are the issues. It's essentially not about the issue of revenue. But in this case now, it's about the issue of revenue. Why should the first choice be to cut worker salary? We know, as a matter of fact, that some of our states are well indulged. They are well indulged in terms of resources. And if we're able to think out of the box, I'm sure that we'll be able to diversify our economy. Don't only rely on coming to Abuja on a monthly basis to now collect resources that in most cases strict accountability is not actually attached to it.
Yeah, but all those would say before this pandemic.
Yes, all of these are factors we need to now look at. One, I agree with you, we are in a challenging period. And that's why I keep emphasizing, even in this challenging period, while workers will be ready and unions will be ready to give some concession, but we must do that also on the basis of clear information that we have before us, where we will engage in a process of collective bargaining. Two, there are also avenues to cut excesses. We now have to do things that are necessary and important and that has direct bearing with the life of citizens. It's about life and death. So we have choices to make. It's about life and death. Which one is more important? To have retinue of 8 or have convoy of 100 vehicles or have a convoy of 2 vehicles and then use the money to save lives? Which one is important and more strategic? So it's to think strategic now. And what we are saying is that when you put the facts on the table, we'll be able to tell you areas where you can cut off, areas where we can do saving, and areas we can also make sacrifices. This is what we are saying in this challenging period. But we don't also agree on a situation where a governor unilaterally will just say, I've deducted worker salary with 25%. I'm also deducting my own with 50%. How much are they earning? Can you compare somebody earning? Because even in the 30,000 we're talking about, when you remove tax, you remove other mandatory deduction, National Housing Fund, you remove pay as you earn. How much is left? It's around 25,000. Can you compare that with somebody that is earning 3, 4, 5, 15 million? If you cut his own with 50%, we go to the same market. How much is he left with? A worker that is earning 25. If you cut 25,000, how much is left? And you know the situation in Nigeria. Every worker today have dependents because of our extended family system. If you are the only breadwinner in the family and you are working, you take care of everybody because of the unemployment situation. This is the reality of the issue. So in the context of taking decision, why not put the facts on the table? Why must we shave our head in our absence, even without dialogue, to say that you have a challenge? Some of them, let me tell you the fact. Before they assume office of governors, we know how much they have declared as their personal wealth. How many of them have come out openly to say, out of my personal wealth, not government resources, because government resources in government coffers is also our common wealth. How many of them have come out to say, I have declared 900 billion?
This notorious coronavirus, their effort this time has been very, very commendable.
When the pandemic was declared, the outbreak was declared, the state was not left out. We as abatelos and artisans, the governor said that most of the abatelos that we should produce PPE. Now me as a good fashion designer, I ventured into that art.
This is Image Akaba Ngwa roadwear face masks are being produced to meet the needs of residents of Aba and beyond. Their work has brought down costs, even as the quality of the product is high.
Producing this face mask in order to help Nigerians, Abia as a whole. So we want to prevent this disease not to enter to Aba, Abia State, not to spread entirely.
We go supply it to people, the hospital, the church, and other individuals. Have the one of 50 naira and of 100 naira. The dozen is 1,000 naira.
150 naira per one, depending on the quality. There are ones we sell in 200 naira.
What they produce here in Aba is not only limited to face masks, they are also involved in the production of personal protective equipment for health workers, still at affordable prices.
When the governor told us to produce locally made PPE, I, through my boys, we bought the medical PPE. We de-assembled it and saw how it was produced. Now, through my own initiative as a fashion designer, we crafted out something unique.
Beyond all this, they are also involved in the production of sanitizers to help residents protect themselves against COVID-19. This they are also complementing by converting buckets to serve as source of running water for hand washing.
People buy it, and as I'm working it, they will buy it. Cost is to 1,300 for 20 liters. You can use it to wash your hand because of germs and everything.
I increase my production since COVID-19 started. I produce sanitizer. Our own sanitizer is very good. The only challenge we have that our people look down on our products without knowing that most of those things they buy from overseas, we can even do better than them when we are empowered. So what we really need is for our people to see the need and patronize us, because Aba, when you talk about production, Aba is very, very good.
The fight against COVID-19 is for all. The artisans in Aba, through their creativity, believe that they have to make their own statement in the fight against the pandemic.
The daily rise in COVID-19 positive cases in Kaduna State has challenged medical and non-medical experts to look inwards in production of personal protective equipment and clinical facilities to halt the spread and facilitate treatment of persons infected by the dreaded virus. Suleiman Abdullahi Rigachikun brings us details on the initiatives.
Since the declaration of coronavirus pandemic as a global health concern by the World Health Organization, medical and non-medical experts have put on their thinking caps towards finding a cure and protective equipment against the dreaded virus. As part of initiatives in the fight against the pandemic, Kaduna State government is collaborating with the Defense Industry Corporation of Nigeria, DICON, to produce personal protective kits for its frontline personnel, while the Barodiko Teaching Hospital, Kaduna, one of the most famous health institutions in the state, has keyed in with the production of hand sanitizers, face masks, and other personal protective equipment.
Devise a means of producing our own, the hand sanitizers. We have hand sanitizers that are produced by a pharmacy department, which we use all around the hospital. And even by the gate, when you are going by the gate, you either wash your hand with chlorinated water, or we put this on for you and you clean your hands with it. Then in addition to that, I also have this face mask, which we produce locally.
Assuming I am infected now, the shield and the face mask will not allow me to infect anybody. And if I come across somebody that is infected, this nose mask and the shield will protect me, together with the glove. So if I want to carry a procedure, now let's assume I have not used the glove, then this is what I will do. So I go this way. After going this way, now I interlock. Yes, that's the way we do it.
Already, a COVID-19 testing center has been established at the Center for Neglected Tropical Diseases, Ahmadu Bello University Zaria, with the initial capacity to test 500 suspected cases and future plan for rapid test of 2,000 suspected cases. The center is seen by experts as a giant leap towards achieving faster results for samples and overall struggle to contain the novel coronavirus.
Our results are quite precise. In fact, what I did was comparing exactly the result I got from Sokoto, repeating exactly the same thing here, and even confirming what we have in Abuja. All of them went as we expected it.
From various backgrounds with a lot of expertise in molecular testing, which we are now going to use that knowledge for testing of the coronavirus.
As of today, the best facility you can think of in terms of equipment, in terms of protection for the personnel that will be involved, is in place.
One of the most critical equipment for sustaining the lives of coronavirus patients is the oxygen ventilator, and the Nigerian Defense Academy engineers rose up to the task by producing it. These ventilators are a creation of engineers at the Nigerian Defense Academy and are very critical in sustaining the lives of victims of COVID-19 and are in high demand in global market, resulting from ravaging effects of COVID-19 globally. COVID-19 has also got some Nigerians to start thinking outside the box.
This reusable mask is for the communities, for the general population. So what it does is it reduces the amount of spread of the virus. Like we all know that viruses are smaller than bacteria.
Materials used in production of the face masks are well thought. You can breathe and speak while wearing it. While researches progress, the global community awaits breakthroughs for either preventive or cure for the dreaded COVID-19.
The investment of Cross River State government in the early production and distribution of face masks, as well as its effective experiment style of the no mask, no movement order, have been described as some of the factors contributing to the COVID-19 free status of the state. Paul Abel reports that these are views of key players in the implementation of the COVID-19 policy in the state.
At the beginning of COVID-19 pandemic in Nigeria, the Cross River State government introduced the production of face masks produced from its garment factory. This perhaps started the era of the No Mask, No Movement campaign. The local production of nose masks by the government also opened up opportunities for individuals to produce the mask for sale, resulting in a more conscious population being aware of the use of these materials as preventive tools to combat the disease, buying the product.
Have people been patronizing you?
Very well. Today I've made so much money and I thank God for that.
So what is your observation? Do you think a lot of people are wearing the nose mask because of the order?
Yes, what I can see, Cross River citizens are very obedient. So many people are buying the masks, some are putting it on.
It's a sell and sell because to prevent the coronavirus to not pass another person.
Some of them make provision for their own masks. Like this morning when I was coming out, in fact, all the vehicles, the taxi I saw, everybody was on masks. And because of that, when I went to my office, I had to also make sure that everybody is also on mask.
Investigations reveal that over 5 million nose masks have been produced and distributed by the garment factory, with 2 million for the state, while 3 million to other states as orders or support. The standard and quality of the mask is set to be certified by NAFDAC.
I provide a solution which I use in Cross River State and it's working great for me. Ensure that everybody is on a nose mask. But then you have to have a quality control over the nose mask. It has to be a triple filter nose mask, which means every single cloth with a good netting system that has a fibrous network that can allow the entrapment of the gelatinous mucus that is being secreted. It's good enough.
Firstly, what we tried to do was to get administrative approval of the NAFDAC. Equivalent is about 0.2 micron thereabouts. So ours about 0.3 micron. So we try to mitigate. We want to be as perfect as N95, but then we meet some level of standard.
The face mask has also kept our economy afloat. So we have over 3,500 workers and recently employed 1,000 workers that have been producing these face masks. The mask has not just been produced for Cross Riverans, but it has also been sent to other states to support the fight against COVID-19 in Nigeria. Presently, we're producing a 3-layered face mask at the Cross River State Garment Factory, which provides complete protection for persons using it correctly.
Apart from the mask, the government says production of other PPEs are also in focus.
We're also working on the production of the overall, which is the PPE, the personal protective equipment, the overall, which would help for people who are working in isolation centers. Also, we have been producing some form of leg wear, which they use over the boot. This is used by health workers that are working in isolation centers.
The consciousness is very high. In terms of compliance, I can very confidently tell you that with what we've seen and going even with the recent days, we have at least 96% compliance rate. Now, if you enter our markets, where you know that that's where you have high density, population, I'm shocked. The minute you step into the market, maybe the consciousness also of the fact that, there's a task force around. As you go inside, you find out that everybody has their face mask. I was in Mbukpa market yesterday. I was at Akum market yesterday. The day before I was at Marion market. I was also at the Ward market. And we're still moving like that. Today we'll get to the Atakpa market and all that. The consciousness is very high.
In the area of enforcement, with an added valuable positioning of task force teams at boundary and border posts, as well as strategic locations in Calabar metropolis, the COVID-19 response team constantly embarks on random visits to markets to enforce compliance.
The mandatory use of non-medical face masks by all persons in public places as part of measures to contain COVID-19 is in turn creating capacity for local development in that area. Kingsley Amajiri reports that while these are macro efforts to grow the supply chain, the micro-entrepreneurs are currently dominating the market.
The mandatory use of non-medical face masks while in public places has sparked interest among those in the fashion industry. They come in different sizes, shapes, colors, and prices. Here in Rivers State, the scarcity and increase in prices of surgical masks have in turn stimulated increasing purchasing of reusable fabric masks.
It was 50 naira before, now we buy it for 400 naira. So that's what we saw here. If we have another alternative, we'll use it.
As I'm talking to you now, I already bought this in to my family. My children, every one of them have their own.
I think a face mask or nose mask is different from a piece of trash. I think I came across a number of people displaying face masks, but when you look at those, these are just pieces of materials. Where they pick them from, you do not know. How hygienic they are, you do not know. So it's not about picking anything and then putting it across your nose and then you're saying you're using face mask.
Many of those sold in the open market are predominantly produced by micro business owners. To some medical practitioners, local production of personal protective equipment are not just providing the right alternatives, but also would help in checking the nation's dependence on importation.
You can wash it, disinfect it, and reuse it again. So the government can come in to assist in terms of making the production of these PPEs more available to the public by contracting out the productions locally and then if possible distribute it to the masses at a subsidized rate, if not free of charge, so that everybody will have it. It will help to reduce the rate of infection of this COVID-19.
Clothing must be the type that is a bit heavy. That is, it is not the type that is easily permeable because some materials are just like handkerchief. Those when the virus will penetrate.
At the state level, there are spirited efforts by some corporate organizations who donate face masks and other personal protective equipment to support government efforts at the isolation centers.
We have donated our items worth 15 million naira to support the state government.
Attempts to verify reports of two indigenous companies collaborating towards boosting local production capacity in the state was unsuccessful.
During the first quarter of 2020, UN agencies have collectively delivered over 6.4 million gloves, 1.8 million surgical masks, and 1 million goggles to every country across the world. However, there remains a significant gap between the volumes forecasted for demands over the coming next few months and the products available in the pipeline. A consolidated UN interagency demand forecast for PPEs suggested the needs for low-income countries for the remainder of 2020 is 2.2 billion surgical masks, 1.1 billion gloves, 13 million goggles, and 8.8 million face shields. That is a whole lot. To address the current bottlenecks and the immediate requirements of countries, UNICEF is working to help countries build supply security and adjust to the new market realities. In Nigeria, the federal government and state governments are exploring other avenues to ensure there is no shortage of PPEs at any point throughout the fight against the pandemic. A fight we shall surely win as long as we obey all safety measures. That's about it on the program. Thank you for your time. I am Lydia Odije-Ochi. God bless Nigeria.
In the midst of the coronavirus pandemic, information management is key.
I'm Cyril Stober.
Fatima Umar Buba.
Joseph Johnson.
Ian Ray John.
Muhammad Kudu Abubakar.
Jumbo Yusuf.
My name is Kirian Umaya.
Here in NTA, we're working very hard to make sure that everything we broadcast is accurate and up to date. Misinformation spreads very fast.
The social media has been a huge conveyor of misleading information from one individual to another, then to another set of groups. In a short while, it goes viral, and before you know it, it is all over the world.
There have been several misleading information on coronavirus, COVID-19. Recently, the misconception of 5G as a cause of coronavirus is becoming widespread. Another is the belief that hot beverages and alcoholic drinks are internal cleanser for COVID-19, thereby leading to excessive consumption of these drinks.
The use of local concoctions as treatment for COVID-19 are yet to be scientifically proven. However, there has been several theories about the efficacies of these concoctions. We should stay safe and denounce all manner of fake news and misleading information on COVID-19.
For medical advice, go on the WHO website, Nigeria Center for Disease Control, NCDC website, or stick with the advisories from the Presidential Task Force on COVID-19 or other authentic official sources. NTA is one of them.
For now, the best and most efficient way to avoid getting infected is through regular hygienic and sanitary practices, as well as social distancing. As individuals, we remain the greatest weapon to fight this pandemic. By washing our hands regularly with clean water and soap, disinfecting frequently used surfaces and areas, coughing into a tissue or elbow, and strictly adhering to infection prevention control measures in health facilities, we can contain this virus.
You can follow us on all our social media platforms: Facebook at NTA Network News, Instagram at NTA Network, Twitter at NTA News Now, YouTube at NTA News Online. Or visit www.nta.ng. For live streaming, visit www.nta.ng/live. Now, you can stay updated on the go, be it on your TV, iPhone, laptop, or iPad, or download the NTA mobile application from your Play Store or App Store. NTA, you can beat the rich.
I am Elizabeth Abad. I am here to talk about facts. There is so much misinformation and distortion out there, especially on the social media. All it takes is just a click and the fake news goes viral. However, here in NTA, we deal with facts.
My job is to go out there and comb for factual news and information, just the way it is, all in the interest of the nation. I'm Naja'atu Tijani.
Here on the NTA, we present only the facts, verified. Beware of fake news, don't be a victim. Stay tuned to the NTA.
Especially at this time of the coronavirus pandemic.
My name is Nnamdi Ojipo.
COVID-19 transmission is mostly through droplets from sneezing and saliva. The most effective way to protect yourself from the virus is to practice good personal hygiene. Wash hands with soap under running water or use an alcohol-based sanitizer if water is not available. Maintain at least 2 meters distance between yourself and anyone who is coughing or sneezing. Cover your mouth and nose with your elbow or tissue when you cough or sneeze. Dispose of the used tissue immediately. If you have traveled recently to a country with COVID-19 outbreak in the last 14 days and you have a fever, cough, or breathing difficulty, call NCDC toll-free numbers before going to the hospital. This message is from the National Orientation Agency.
24 hours a day, 7 days a week. You can watch NTA International live on your TV, computer, iPad, tablet and phone. Log on to visiontv.co.uk and click on Entertainment, then NTAI. You can also download the iOS or Android app on your mobile devices to watch NTA International on the go, anywhere in the world. NTA International, your window to the world.
Every celebration is an opportunity for cake lovers to explore new recipes. It might interest you to know that in recent times, some bakers are committed to developing new cake recipes that offers varieties in terms of taste and texture. Such combinations are sure to give you a memorable delight to your taste bud at any special occasion. You're watching Baker's World on NTA. Thanks so much for joining us. My name is Funke Oyele. On this episode of Baker's World, we'll be showing you how to bake a decadent cake suitable for Lovers' Day celebration. Our baker is a young and creative woman who's been able to create employment for herself after graduation. Our conversation segment says more about this baker. All this and more for you today on Baker's World. Just relax and enjoy. Red velvet cake has a buttery flavor that differentiates it from chocolate cakes. We're familiar with either the oil or the butter-based red velvet cake. Are you aware that you can achieve the perfect taste and texture if you combine both butter and oil to make a red velvet cake? On this segment, our baker Sarah and Joy will show us how to make a moist, soft and buttery flavor red velvet cake. I'm sure you're itching to see this. Don't go anywhere.
The first thing we're going to do is to make our buttermilk. To make your buttermilk, you take 1 cup of milk, of liquid milk, and you add to it either 1 tablespoon of lemon juice or white vinegar. We're going to be using lemon juice. While Joy is doing that, we go straight to mixing our butter and sugar. So this is our butter. We use unsalted butter. Sugar. We are going to be mixing our butter, oil and sugar until it is light and fluffy. We'll scrape down the sides and then we'll mix again. Now look at this. It's not as yellow as it was when we started mixing. So our butter and sugar are properly mixed. Next is eggs. And we're going to be putting the eggs one at a time. We don't just lump all the eggs in. Next is our flavor. You can use any flavor of your choice. But for this red velvet cake, we'll be using vanilla flavor and strawberry cheese flavor. Once your eggs are properly mixed, you alternate your dry ingredients and your wet ingredients. You begin with flour and end with flour. Make sure you mix it properly. Add our flour. Next will be our buttermilk. Take note of this important part. We're going to be adding our baking soda and white vinegar. This is about the most important